Welcome to the Retzel Health Law Hotspot. Health Law Hotspot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Hi, everyone. Welcome to the Health Law Hotspot. I'm Ericka Adler, shareholder and leader of the healthcare practice at Retzel and Anderson. And today we have a very special guest, Amy Anderson, who's joining us from Brinson Anderson. And Amy is a specialist in working with practices, in particular, those that are engaged in plastic surgery and aesthetics, in order to grow and help their practices become successful. So welcome, Amy.
Thank you. Thanks for having me.
My pleasure. And today we're going to talk about the topic about how to find the right people for your practice. And what that really means is the people that are going to come and join your practice, help it to grow the most that it could grow, and that also will be a good reflection of the practice's brand, which is super important when it comes to plastic surgery and aesthetics. So this is a really interesting topic. So let's jump right in. And why don't we kind of have you tell us basically your thoughts on this topic and take us through the points that you think are important to cover.
Absolutely. Well, I work with dozens of aesthetic practices, and I can say with confidence that the number one problem that every practice seems to be facing is around staffing. And how do we find the right people that have the skill set and the experience that we're looking for, the licensure, if required, depending on the role they're in, and then ultimately who's going to be a reflection of the brand. And I remind physicians how important it is to hire slowly and to really make sure that any employee brought onto the team is fully vetted, and because every interaction they have with patients is a reflection back on the physician and that aesthetic provider. And even to the degree that I have heard patients say, if my experience was this bad trying to make an appointment, I can't imagine what this doctor's like, right? And like, it kind of blows our minds, but if they have a poor experience with the front desk or with the intake process, there's this correlation that the doctor must not have it all together. And so obviously that's a worst case scenario that we want to avoid. So I work a lot with practices on how to really fine tune their interview process to find and attract the best people for the job. And I think it starts with anytime there's an opening that we pause. We tend to have this anxiety of somebody just resigned, somebody's leaving. We need to fill the job as quickly as possible. And listen, I get it. Like, you have busy schedules. Most practices can't afford to have a gap. However, it's a premium time to pause and say, who is it that I really need in this job? Let's think about the job duties, think about the responsibilities. A lot of time in practices, job duties get shifted over time, and we may now have a person doing a role that doesn't really make sense, but that previous person kind of absorbed it. So it's a great time to just take a fresh look at the job description and reassess what is it that's actually needed. It doesn't need to be a 3-day process, but maybe 30 minutes to run through that job description and confirm.
And do you find that people are resistant? One of the things when I work with practices and they've done things a certain way, it's hard for them to accept that there might be a better way to do it, or they have certain people that they trust and they do such a good job in multiple different roles. And either they're resistant to making those changes, or the people that hold those roles feel like they're being somehow downgraded or diminished by those changes, which can make it really hard to put improvements into place.
Absolutely. I mean, managing staff through change is a big part of it. Everything that may have a logical or rational decision, reason behind it, there's also an emotional component. And so supporting people through changes, if it means changing their job duties in this process. One of the things when we look at job descriptions that I focus in on heavily, and I'm sure, Ericka, that you get involved in this as well, is what is the licensure or certification required for these job duties? We see this a lot in aesthetics. There's a lot of misinformation or just lack of knowledge about scope of practice. and who is legally allowed to provide certain treatments and run specific devices. Because as you know, it's a state by state and sometimes maybe even city or county by county ordinances as to who has certain scope of practice. So for example, I live in Indianapolis, and Indiana tends to be one of the looser states in terms of what physicians are able to delegate to a member of their staff. So, in that regard, as a medical assistant, which we know is not a license, it's a job title, it's on the job training in most areas, can perform certain functions up to and including injecting neurotoxins, fillers, running lasers as a delegated task from a physician. It still requires oversight and training. It doesn't mean they can just, evaluate and diagnose and treat patients independently, but they can run those devices. Whereas I have a surgeon in Alabama who he is the only one in his practice that can inject. As a physician, the PAs and NPs even are not able to inject in that state. So there's so much variety, and I feel like there's a lot of misinformation around this. Are you seeing that as well?
Definitely. I think that also if practices do things and they know that other practices do it, they assume they're doing it properly, right? I hear the excuse all the time, well, that's how everybody does it, right? But the laws are very quickly changing in many states. I recently was working with a doctor in one state where she'd been doing the same thing as everyone else for many, many years, had a great practice, and only recently found out that the law had changed. And she wasn't aware of the change in law. When she called around, none of her colleagues knew, the medical board didn't know. And the effect of this law really was to change exactly who could delegate, who services could be delegated to, who could supervise those services. And it would have a huge impact on her practice, because in many of these practices, the way they're able to grow and become so successful financially is that the doctor doesn't need to be there all the time overseeing everything. When someone's trained, they can have multiple mid-levels or other people doing some of these services. Well, if the doctor is the one that has to be doing everything or has to be there physically to supervise, or people who previously were able to do it, but now let's say it's only a mid-level and not a regular RN or MA that can do it, it changes your practice structure. It changes the volume that you can achieve. It changes your financials. It has a huge impact. And in that case, she was able to get together with colleagues, and they achieved some changes in the law actually, and got some delays on something. So, but that is just one little example. And I think we're going to see changes like that. And I guess the question is, who's behind those changes? I'm not sure. I think, a lot of physicians are opposed to the delegation of services to non-physicians. So we're seeing some of that in some states as people are more vocal than others, right? In other states, it may be even the different types of non-physicians fighting amongst themselves for who has the right training, et cetera. So it is really important, and I guess one thing we should mention is that if you're not compliant, it's not just a financial outcome, but it could be a violation of the Medical Practice Act in the state that the doctor's practicing, as well as the licensure of those individuals working in your office. So it's not just like, oops, we made a mistake. You can actually get investigated and get in trouble. And if you're looking potentially to sell your practice down the road, that can have a huge implication. So yeah, these licensing issues are tricky. And I don't think people pay enough attention to them.
I agree. And it's a huge area of risk for a lot of practices. And it doesn't have to be. I mean, it's a little bit of time with a healthcare attorney like yourself and your team. Periodically, let's just reevaluate. Let's make sure we're still in our scope of practice. And just know that we're doing it the right way. Yes, there are some financial implications, but we can work around that. We can be creative if you're in a state that is more restrictive, but it's not worth the risk, to have people practicing outside of their license.
Right. And I'll mention one other thing, that in some states, they're very strict about the number of different types of people that you can supervise, right?
Right.
So if you have a practice, you may be limited how many MAs, how many nurses, how many PAs, how many APNs or nurse practitioners. So you're kind of limited by state law as well. And not everybody realizes that. Again, for a doctor, that can be a violation of their Medical Practice Act.
Yes, that's a great point. And my final note on that is, this is not meant to be a bash on industry, but I wouldn't suggest taking the word of the laser device rep as to who can run their laser. Some are knowledgeable, some are not. They're ultimately trying to sell you a device. And so like them, they're great people, but we don't want our legal advice coming from the laser salesperson.
Right. That's a great point. I've actually said that before on this podcast, that a lot of doctors, when we get involved with them, all of their information came from the rep. And it's, you're right. Sometimes they're like, go talk to your lawyer, or the advice they gave was correct. But in many cases, it's like at a conference, like a med spa conference or something like that, where they bought the laser, the equipment, and they take it as the holy grail of advice and assume that it's correct. And people don't realize that state laws can vary so much. And especially for practices that may cross over state lines, and there's quite a few that do that. You can see a difference right there. So even if you have licenses in multiple states and you have some of your staff crossing over those state lines, you have to know what every state requires. So really great point. One related thing to think about also is that the supervision of the service is one thing, and maybe you know more about this even than I do, but a lot of times, even if you could supervise a service, there needs to be like at least an initial visit with a doctor, and a lot of people don't realize that. They're aware of the supervision rules, and they do those just perfectly, but they don't document a physician visit initially, and I've had some of our docs get in trouble for that too. So
it's a great point. Some states refer to it as a good faith exam. There's different vocabulary around it, but you're absolutely right. It's an area that can be lacking. And again, we help a lot of practices come up with an efficient way to do that. It doesn't need to be a 30-minute visit with a physician. A lot of them are a very brief encounter, but ultimately the physician is diagnosing and recommending a treatment plan, right? We can't delegate that to most lower level licensures or positions. And so that physician still has to retain that piece of it.
Exactly right. All right. So we know what we need to hire for our practice. How do we narrow it down? And I guess, are there people out there looking for jobs? We heard about the job market. Are there really good people out there to find?
There definitely are. The landscape has changed, but there's still very much an active workforce and people who are either in another position and looking for a change for whatever reason. Sometimes they're relocating, sometimes they're just ready for growth or a new experience, a variety of things. So I have not had problems at this point finding good candidates. But I do think it takes good interview skills. And so my first piece of advice is to start with a video interview, because you pretty much know within about 2 minutes or less if this is somebody you're interested in. And it can be a giant waste of time to bring them into the office. I think it's a waste of their time. If somebody's sitting in front of me, I feel this obligation to spend at least 20 minutes with them, right? I'm extending this interview, even if I know immediately this isn't the right fit. So using video technology that pretty much everyone is adept with now since, the pandemic, whether it's FaceTime or Zoom or Teams or, you name your video platform. And I introduce it as an introductory screening interview. So I'm setting that precedent that it's going to be short. But it's amazing even how much it tells you about a person, where they decide to take this interview, how they present for it. Do they dress like it's an interview? Or do they have a messy bun on their hair and a slouchy t-shirt on, like they're just talking to a girlfriend?
They're sitting in their car, right? Or they're,
yes,
yeah,
that's exactly. And, I'll be forgiving if they're in their car, if it's scheduled around their lunch break or something. I have to be a little flexible there, but I want to know the circumstances of it. If they're not driving in their car, that would be different. But so The video interview has been a big time saver for a lot of my practices, just to do that initial screening. But once you find somebody, like, definitely bringing them in. And I encourage practices to get other employees involved, that it's not just the physician or the main provider or just the manager, that we get other perspectives. Because I think everybody kind of picks up different elements, and ultimately we're hiring for the team. This person's going to be working with your other team members. And so we want to ultimately make sure it's going to be a good fit culturally, that this is somebody who seems like they get it, that they seem like they're a reflection of the brand, who kind of has similar, not necessarily personality, but work styles. And because no two practices are the same. And I do think there is this misconception that, well, if this applicant worked for this other premier dermatologist or this other well-known plastic surgeon, they're going to be great in my practice. And that's not necessarily true. I often say interviews like dating. When you're dating and you meet some great people out there that have good, strengths, good attributes, but they're not the right fit for you, right? And so we wish them well, but it doesn't mean we get married to every nice person that we go on a date with. And I would say the same thing about interviewing, that we have to really feel that connection and make sure it's truly going to be a right fit for the practice for the long term.
That makes sense. And so when you're talking with them, obviously you're looking for enthusiasm for the position, an explanation for why they're interested in a particular industry. So those would be real pluses. Are there personality things that are red flags for you that you see that maybe they won't be a good fit for a practice in general?
I would say I listen to what they say as much as to what they don't say, reading that body language. I'm always asking, why are they considering changing jobs? If they're, leaving a current position. I'm listening, frankly, for drama, for indication that they didn't get along with somebody. And listen, that happens. I'm realistic, but then I want to know why. And I am going to dig into some details and say, oh, tell me more about that. And really, how somebody presents it can be very telling. So any kind of sign of drama is a red flag. If it's coming up on the first interview, it's probably going to become more apparent once they're working for you. And I'll often tell people, go with your gut. If something just seems off, it probably is. And anytime I feel like we've tried to rationalize or explain away something that was a little funny, it always comes back around to bite us. It's always like, no, we kind of knew when we interviewed that there was something off, and we tried to make sense of it. And then it just really gets amplified once they're hired and in the practice.
So what does your process look like then after your video interview? You kind of narrow it down, and then what happens?
So definitely then moving my top 2 to 3 to an in-person interview in the office. Like I said, getting other people involved. I do like to have them sign a confidentiality agreement and then shadow for a few hours because I think it makes a difference. Everybody's idea of a busy practice is a little bit different. Some people will say 20 patients a day is busy, where others will scoff and say, no, trying to do 60 or 70 a day, that's busy. So I want them to see what busy actually is, whether they're front desk or medical assistant or a provider themselves. If this is a nurse injector or somebody that we're hiring, I want them to have a realistic idea of practice volume, of what the workflows look like. And I find during those shadowing interviews, you learn a lot more information. They tend to be more relaxed. They're maybe not sitting with the manager or the doctor. They're sitting with a prospective colleague or coworker, and they become a little bit more loose-lipped as well and start sharing more information. And so I think I've just had a lot of good experiences with the shadowing, either solidifying this person gets it, like they seem to be even recognizing in the EHR what needs to happen. They just seem to be really switched on, or other times where they just seem like a deer in the headlights and lost. And we're going, maybe this isn't really going to be the right fit after all.
So when you're first looking for candidates, so how do you make sure that you're kind of advertising that position in a way that you're going to, get the right people? I mean, you don't want to do video interviews with people that aren't the right fit, where there's a total disconnect about what you're looking for. So first of all, I guess, where do you recommend practices advertise for the people they're looking for? And then how do we write those advertisements in a way so that you get good candidates on the video and then good candidates kind of coming in? Are there like certain keywords so that you know you got it right by the time you're meeting them in person?
It's a little bit of an art and science, and I wish I had a perfect formula because it takes a lot of time to screen resumes and then to do the screening interviews. I do not post a full job description online because I just think it's a lot and most people don't read every line of it. So I condense it into a job ad that is summarizing the key points of, what you must bring to this role and the tasks and duties that you're going to do. I believe in being very honest and transparent. Let's not lie about the job or make it sound like something it's not. Like, we should be very straightforward with what it is. And then I'm not necessarily partial to any of the online platforms. In my company, we use Indeed primarily. It has worked well for us. It has the tools and things that we need. LinkedIn for manager positions and sometimes the provider or nurse positions. And then there's one called Healthy Careers that is good for physicians, physician assistants, nurse practitioners, those higher licensed individuals. But really, I'm living mostly on Indeed. Indeed does allow you to add screening questions that they have to answer. I utilize them, but I don't necessarily rule out a resume based on the answer because they can kind of answer however they like. And so, it helps narrow it down. But I think after what you just kind of develop an eye for looking at resumes and not just seeing if they've had the exact same experience, because often they don't, but what are some relatable traits that could transfer over to this job. So if I'm hiring a front desk person and they've worked in hospitality elsewhere, at a higher end hotel chain or a fine dining establishment, okay, I'm interested because I'm going to hope and assume that there's some degree of customer service that's kind of ingrained in them, that they're attracted to that type of role. And then I can teach them the tasks of our office. Can't necessarily teach that hospitality type mindset.
I guess, one of the things I always notice about my plastic surgery, aesthetic type practices, how pretty everybody is, right? Like everybody's very good looking. Everybody, not everybody, but they're all very into their appearance for the most part. They're stylish. They take care of themselves, etc. And I guess those are probably the people that are very attracted to this industry also, because those are that are important to them. Obviously you can't advertise for that, but I assume that when you advertise, you say it's a plastic surgery aesthetic practice. And is it a magnet for those kind of people? I mean, I assume you're not just choosing the pretty people, right?
Right. Well, some of my doctors tend to have that be their number one criteria, and I steer them away from that. But yes, I do indicate what type of practice it is. And I do think the person has to be interested in this specialty and in just aesthetics in general, because if you don't care about it, it can be difficult to relate to patients who are seeking these services. And I think in any industry, you need to believe in what you're selling and what you're accommodating and treating. And so it does seem to lend itself. One line I use in my job ads and job descriptions is a neat, polished appearance. It's not saying you have to be pretty, but I am setting this expectation that there is a polish and a finesse that you have to bring. It's not wearing wrinkled scrubs and messy hair every day, right? Like, we do have some expectations. I also want to caution on, the maybe too enthusiastic user of aesthetic treatments who comes in a little bit overfilled and having a distorted look. And if they're a reflection of you, and patients will assume that your doctor or your provider is the one who did those treatments. And I mean, I guess
especially if they don't look good, right?
But yes, if they're over injected and have too much of an extreme look, and that's not your aesthetic, your your whole angle is we get very natural looking results, that can be a disconnect because, and those are the tough situations to navigate. Again, I don't necessarily just rule somebody out from the beginning, but they need to really be, the best candidate in all other areas. And then we do have to talk about that.
Right.
About
Oh my God. I think I would be wondering the whole time what they were thinking about the treatments that I needed. I work with a lot of aesthetic doctors, and when we talk on video, I'm always like thinking, sometimes they'll say, you should come stop by and see my office. And I'm thinking that's like code for we should take care of those, crow's eyes that you get over there, right? So, I understand it is very a certain aesthetic, and you need people that kind of fit that aesthetic or that vibe. And that's true of any business. And obviously, you have to be very careful. There's so many questions that you can't ask when you're interviewing someone, right? And we can't choose people, taking into account anything that, is illegal in terms of their age, their sex, their whatever it is. So, but I guess the idea really is to promote it as a job that's the right fit for the right person, right? But you're not going to want to work there if you think, plastic surgery is stupid and nobody should do it. That's not a good fit, right? So
Not a good fit.
we're going to try and find those right people. Now, have you, I guess this is kind of a weird question, but when you want to hire someone you think it's a good fit, do the doctors kind of defer to you, or do they chime in? And have you ever disagreed? I'd be curious as to kind of what the difference of opinion comes down to, because you get a lot of experience, but a lot of doctors may feel like, they know better, obviously. So how does that work out?
Well, so usually when I'm working with a practice, we will take on that legwork of posting the ads, doing all the screenings, and then lining up 2 to 3 people for them to meet so that, we're really protecting their time. Absolutely, the doctor has to meet the potential candidates, and it is ultimately their decision. So we usually have dialogue about it. If I'm not going to pass along to them somebody that I don't think is qualified, we might kind of go back and forth of who of the final candidates is best fit. But ultimately it's their practice, it's their business, and I will give them, my opinions. But, I don't have a crystal ball either. And so we're all kind of, it's a little bit of a gamble when you hire a new employee. We don't have that certainty. Another thing I hear a lot is, well, I just want to make sure she's going to stay here for a really long time. I'm really sorry. There's never any guarantee of that. No matter what the person tells you, that's always a potential risk. So, I see myself as an advisor. I'm definitely an advocate of the practice. And then I'm going to support whatever decision the physician makes, unless it was something egregious, like they don't have a license to do the job that you want them to do. Then I would say, I can't be part of this. But that's really never happened to me. So once they make their selection, then often we will facilitate doing the background check. You cannot skip on the background check. For me, that's a must on every position. And then checking references. I do strongly believe in references. If they've ever worked for another physician, I prefer if we can do a physician to physician phone call, because it just seems to garner a lot more information than the calling the HR department or calling them. You kind of get the standard just confirmation that they worked there. But if we're trying to get a good reference, I do ask for a physician reference if they've had that experience before. Right. And then one final thing that I think I'm utilizing more that I think is helpful for practices. Sometimes we are doing some assessments, like some skills assessments. So I've had a lot of practices recently frustrated with the written communication of some of their staff, whether it's email to a patient or how they're writing in the chart, that the grammar is not very good. There's a lot of misspellings. And so I've given some applicants writing tests, and it's as simple as when they're in person, I put them at a computer with a blank, document, and I have to give them a topic. Like, I don't want it to be technical because they may have never worked in aesthetics. So I'll say, write 2 to 3 paragraphs about the last vacation that you took, right? Something like anybody can write about. And it just helps you see, can they write? Can they write cohesive sentences? Do they use the proper punctuation? Does it make sense? I give them, 15 minutes or so to do it. Again, it's a low pressure thing. but it's very telling as to what will their written communication look like in the practice.
And what do you find on average? I'm really curious about that.
I find average. I guess I have to manage my expectations. If if it's not a marketing position that's going to be heavily writing, I really just want to make sure they're using proper context and grammar. And most of the time they are. And it's also setting the precedent that this is very important to us. And the way we communicate has to be polished both verbally and in writing. And so the fact that we do it in the interview, I think, is also sending a message, when we go along into training, that this is so important for us.
Wow, I think that's great. I've never heard of anybody doing that. A lot of times in other industries, you might do personality tests, or you might, like, for example, if I'm hiring, somebody in law, I might be looking for a writing sample, right? But it's really interesting to have them do it on the spot. And, a lot of people working in derm and aesthetic offices and plastic surgery offices, a lot of them, especially front desk and younger nurses, injectors, whatever, they can be young, right? So maybe they have graduated in the past 5 years or 10 years. I can only say, having, 2 kids in college myself and 1 in high school, that things have really changed. And I'll be really curious, talk to you again in a few years and see what you see. But, they don't know how to write by hand at all. And they rely on spell and grammar check, and their abilities to kind of do it on their own is limited. And with the emphasis really on kind of STEM in school and technology, it's becoming almost a lost art to be able to speak properly, not in slang, not in, like, sometimes I don't even understand what my kids are saying. But, and I try to say to them, and, it's a very hard lesson for a young professional person to learn, that you have to speak and professionally and talk in a certain way. So it can be a learning experience. And I think that's really interesting. If they were not ready when they took your little test, and that they'll be ready for the next one.
Right, exactly.
Right.
Yes.
So I think that's really a really great piece of advice, and for any practice, actually. But all right. So any final pieces of advice here on what people should be thinking about when they're looking to hire, when they're going through that hiring process, and those key things that you want plastic surgeons and aesthetic practices to think about when they're looking for the right person to work for them?
Yeah, I really think it goes back to, it ultimately needs to feel like the right person. And I'm not trying to be like so, soft and everything, but like it does need to be that good fit. And we often say in aesthetics, and certainly in plastic surgery, our patients are making emotional decisions to have these treatments, right? They're in the practice because there's something they're self-conscious about, and they want you to not just make them look better. The look better is to make them feel better. And I think that's important to really think about. And every one of our employees have to get that, have to have that innate ability to connect with patients, to truly, genuinely care, to, have those soft skills. And so I think that applies in hiring as well. I want to really connect with this person and feel like this is my person. He or she can be part of this team. And I think they're going to be a good fit. And then just the final note is not to undervalue onboarding. So often we get to that final, we've hired them. Yes, we're so excited. Okay. And then our work here is done. And it's not, it's only just started. And the ultimate success of employees does depend on investing a little bit of time in just planning out their first week. Even what are they going to do each day for a week? Who are they spending time with? I heavily believe in shadowing all positions in the practice. It doesn't need to be for a whole day, but an hour or two in each role, so they understand how everyone's connected, how the work they're doing is connected to their coworkers. Too often we work in silos, and then we have like this collision from the front office to the back office. They don't understand why they can't get things right, but they just don't understand that full workflow. So
and I guess, and the whole training process doesn't stop after 1 week, right?
Of course not.
I guess the practice has to really be invested in helping that person be successful.
Right. And it's hard. It's hard because training takes time and it slows things down. And no practice I've ever met says, oh, we have all the time in the world for this, right? Everyone's busy. And that's why I don't want it to all fall on one person. If we can spread out, having different parts of training performed by different people in the practice, so it's not all on one. And then the manager or physician, depending on the structure of your practice, you need to check in very regularly, at minimum weekly, but that first week, even every day. How are things going? Making sure they're progressing. How are, they feeling like this is a good fit? Asking your other employees, how are things going? Because we can make a lot of changes quickly in the beginning. The longer they're there, the more challenging it can be to redirect.
That's excellent advice. Well, everyone, if you're thinking of hiring for your practice, and by the way, this is great advice, not just for plastic surgery and aesthetic practices, but this is hiring and what it really looks like in any physician practice. And, I almost think sometimes there should be a refresher when you've had somebody working in your practice for many years, your staff is there, they lose a little bit of that enthusiasm for how patients are treated and how they interact with patients. So this is good advice, whether you're hiring or you have a long-term staff, to really think about the impression that they give patients coming to the practice, which helps your practice be more successful. So thank you so much for joining us today, Amy, and we will share your contact information. If anybody has any questions or would like to use Amy's services, we'll have all of her information and you can reach out directly to her. If anything I said here leads to a question, you can feel free to ask me, but I think Amy's more the expert on this topic. And we hope you'll come on and talk about some other topics again soon.
I would love to. Thank you so much for having me.
Thanks to everyone for joining us today. This is the Health Law Hotspot, and you can catch more of our episodes at ralaw.com, and we'll see you next time. Thanks.
The Retzel Health Law Hotspot is made available by the firm and its attorneys for educational purposes and to provide general information, not to provide specific legal advice. Use of the Retzel Health Law Hotspot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Retzel Health Law Hotspot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.